Hi, I'm Beth Basler, and I'm a family nurse practitioner. For the last 8 years, I have practiced in oncology with a specialty in breast health. I currently practice as a family nurse practitioner. The first thing that I'd like to discuss is self-breast exams. We've all heard of these before and know that these need to be done on a monthly basis. However, most studies show that women do not do it on a monthly basis. We know also studies have shown that if we do monthly breast self-exams as well as a yearly clinical breast exam, that there is a decrease in breast cancer as well as early detection of breast masses. The way you need to do a self-breast exam is to stand in front of the mirror. The first thing you want to do is raise your hands, and what you're looking for as you're standing in front of the mirror is any abnormalities in your breast, such as change in color, change in texture, such as a roughness, or any abnormal masses or nodules that may be sticking out in a different direction or just don't look right to you. What I want to remind you is that you are the best detector of abnormalities in your breast. You are the person that knows your breast the best, and that is why doing monthly exams is very important. After you examine yourself with your arms raised up like this in the mirror, you want to turn at different angles and check both the sides from the left and the right. Also then you want to put your hands on your hips and look in the mirror as well. The reason why you're doing different positions is it will stretch the skin in the breast in a different way. After you have viewed yourself in front of the mirror in these two positions, you want to examine your breast standing up in front of the mirror. I have an example here of a breast, and as you're standing, you basically want to raise your arm on the breast side, and you want to feel the breast starting down with your armpit, working your way into the breast area. There's two ways of doing breast exams. One is in a circular motion where you start and you go around the breast in a circle, and the other way is a line form where you come in starting from the outer breast and work your way into the nipple, and that would be continued from the outer part into all the way to the breast. So you should do this examination in front of the mirror, and then as well go ahead and lay down and do it on the bed in the same fashion, laying on your back with your arm raised up. One area to pay special attention to that most women don't is the armpit region. We have lymph nodes there that you want to detect and make sure that there's no enlargement in that area. Next, I would like to talk to you about mammograms. Right now, the current recommendation for women to start getting a mammogram is between the ages of 35 and 40. It is recommended that you get a baseline mammogram at this time. After the age of 40, it is recommended that you get a yearly mammogram. Many women will ask me, well, why don't we get mammograms earlier? Why don't we do them at the age of 30 or the age of 25? The reason why we do not do mammograms at an earlier age is younger women have dense breasts, and unfortunately mammograms are unable to detect abnormal masses on dense breast. The next thing I'd like to talk to you about is the MRI of the breast. The MRI of the breast is a fairly new test used in breast cancer detection. The MRI of the breast is a little more detailed examination that requires an injection of dye as well as about an hour examination. There are drawbacks to this test in that it is very costly compared to the mammogram, and insurance companies are somewhat leery about paying for it. If a woman does have a personal history of breast cancer, the insurance companies seem to be paying for it right now. I think probably in the future we will hear more about MRIs of the breast, and they will be more of a readily available test for women for detection of breast cancer. The next thing to talk about is, what if we do feel an abnormality? What if there is something wrong with our breast that we question? The first thing I can say to you is try not to be scared. One very important thing to remember is about 80% of breast abnormalities that we feel are benign, which means they're non-cancerous. So the first thing to remember is if you feel something that's just not right on your breast, or you see something that's not right on your breast, is try not to be scared of telling someone about it, because more than likely it's nothing to worry about. The first thing you should do is, if you do a self-breast exam and you feel something that just doesn't feel right, Or your husband's spouses sometimes will say something doesn't feel right. What you need to do is call your medical professional, whether that be your gynecologist, your family practice physician, or your internist, and let them know that you feel or see something different on your breast. The next thing you need to do is get a clinical breast exam, and that is by a physician or a nurse practitioner or a physician assistant that's going to feel your breast and see if the lump you feel or the abnormality that you see is something they are worried about also. After you go through that clinical breast exam, the person who examines you is going to recommend if you need further testing. These further testing usually will include having an ultrasound guided biopsy. This can be performed by a radiologist or also by a surgeon. This then will allow them to sample some tissue and send it off to the lab. Within about 3 to 5 days, you should know if this mass that was felt is something cancerous or if it is non-cancerous. There are a few steps we can take as far as healthy lifestyle measures as well as preventions for breast cancer. The first thing we know is not to smoke. Everybody's heard that. But some of the research does show that a person that is a smoker does have an increased risk for breast cancer, and as we know, as well as other cancers such as lung cancer. Another step is to limit our alcohol. Studies show that women that have a high intake of alcohol on a daily or even a weekly basis have an increased risk for breast cancer. Another thing we can do is try to keep our weight normal, or what we now hear is our BMI, which is our body mass index, which is a percentage of our weight and our height to give us an idea of what is a normal weight for us to be at. We know that women that have a higher weight or a higher body mass index, BMI, have an increased risk of breast cancer because of circulating estrogen. We know from research that women that have higher estrogen levels have an increased risk for breast cancer. When women are abnormally overweight, they carry a higher percentage of body fat. Body fat is known to hold estrogen. So if you have a higher level of body fat, you also have a higher level of estrogen circulating in your system, therefore increasing your risk for breast cancer. Another thing that goes along with circulating estrogen that is also a preventative measure for breast cancer is when you hit the menopausal stage of life is to talk to your medical professional about the use of estrogen products. Research does show that increased estrogen circulating in the system can also increase your risk for breast cancer. So medications such as Premarin and Prempro should be discussed with your healthcare professional before taking them. Recently, there have been 2 medications approved for the prevention of breast cancer. Both of these medications, which are in a pill form, have actually been on the market for quite some time. One pill called tamoxifen has been initially used for the diagnosis of breast cancer, and the other pill called Evista has been used for osteoporosis. Both of these have been studied and shown to decrease your risk of breast cancer. Women that have an increased risk of breast cancer due to family history are candidates for taking these medications for 5 years, which will decrease their risk of breast cancer. These medications should be discussed with your healthcare professional as far as if they're necessary for you. Another thing to remember is if you have an increased risk for breast cancer within your family, such as a grandmother or a sibling or a parent, the best thing is to talk to your medical professional about your risk for breast cancer. There are actually tools now that will help you know your 5-year risk as well as your lifetime risk for certain cancers such as breast cancer. The way of detecting your risk for breast cancer is done by a calculator called the Gale model. This is actually a calculator that you punch numbers into that gives you a percentage of your risk for breast cancer for 5 years and then a percentage of your risk for breast cancer over a lifetime. The things that are considered when they look at your risk for breast cancer is your age, your race, how old were you when you had your first child, how old you were when you had your period, if you've had any breast biopsies, and how many family members have had breast cancer. The family members that count on this calculation are your mother or your siblings. They do not take into account your father or grandparents for this calculation. When all these numbers are put into this Gale model calculator, they then will give you a percentage of your breast cancer risk at 5 years as well as for your lifetime. This percentage is then compared to the normal population, and you will know if your risk for breast cancer is higher than a woman your age. A fairly recent new topic in breast cancer has been genetic testing. There's a lot of talk in cancer in general about testing genes to see why people get certain cancers. They now, with breast cancer, have been able to target 2 genetic mutations that show women at higher risk for breast cancer. These 2 genetic mutations are the BRCA1 gene and the BRCA2 gene. These detections are picked up from a simple blood test. These genetic mutations are found in about 5 to 7% of the female and male population. These 2 genes, the BRCA1 and the BRCA2 gene, play a role in blocking off abnormal cell growth. We know that most cancer cells start from a single cell, and then something triggers them to continue to grow abnormally and then out of control into actually a mass that causes problems. What these 2 genes do is they act as a blocker and prevent cells from growing abnormally. So if you would have a BRCA1 or a BRCA2 gene mutation, that would mean the gene does not work correctly and therefore would not cause blocking of this abnormal cell growth in breast tissue or even in ovarian tissue. The BRCA genes contribute to about 5 to 7 ovarian and breast cancers found in the population. The BRCA1 gene mutation is more commonly seen in breast cancer, whereas the BRCA2 gene mutation is commonly seen in ovarian cancer. Further interesting information on the BRCA1 and BRCA2 gene mutation is that actually 50% of these mutations are passed down through your father. Most women, when they consider their risk for breast cancer, are always thinking of their grandmother or their sister or their mother, when actually some of this can be passed down through the father's side. That's why it's very important when you're thinking about genetics and talking to your healthcare professional, you actually look into your father's side of the family for their cancer history as well. The BRCA1 and BRCA2 gene mutation has also been shown not only to increase your risk for breast cancer and ovarian cancer, but as well as other cancers such as melanomas, and also a 6% chance of having male breast cancer pass through the family. The BRCA1 and BRCA2 test is performed in the office and as a blood test. The downside to this is it's a very expensive blood test, and some insurance companies sometimes don't want to pay for it. The person that needs to be tested first for a genetic mutation is the person that was diagnosed with breast cancer or ovarian cancer. For example, if your mother had breast cancer and there's some question if there is a genetic mutation in the family, the ideal situation would to have your mother actually go for the breast cancer blood test to look for this genetic mutation. If this mutation would show up to be positive, then you look at testing other family members such as daughters, sisters, and mothers. Most insurance companies will pay for it if there is a note written from the doctor showing the necessity of this test. The test is usually back in about 3 to 4 weeks with either a positive or a negative result for a BRCA1 or a BRCA2 genetic mutation. Remember that the probability of this is fairly low, only showing it to be positive in about 5 to 7% of the population. Many people will ask, well, what if I find out if I do have a genetic mutation that is BRCA1 or BRCA2 positive? What is the next step to do? What we usually discuss with a patient is talking about doing a mastectomy, actually taking both breasts off, and even doing a bilateral oophorectomy, which is a removal of both the ovaries. The reason why we recommend removal of the breast as well as the ovary is that we know the BRCA1 and the BRCA2 genetic mutations can cause abnormal cell growth in the ovary and the breast area. There's a certain criteria for who should be tested for BRCA1 and BRCA2 genetic mutations. The first person is any woman under the age of 50. Because breast cancer is not very common at a young age, you think more often of genetic mutations at a younger person, such as a 35-year-old or a 30-year-old diagnosed with breast cancer. The next person that would be a candidate for BRCA1 and BRCA2 testing would be any family member that was diagnosed with breast cancer or ovarian cancer. This would include a mother, a sister, or a grandmother. Another criteria for BRCA1 and BRCA2 genetic testing is if you have a family history of male breast cancer. We know the incidence of genetic mutations are passed through families when there's male breast cancer present. And one thing to remember about BRCA1 and BRCA2 genetic mutations is they are most commonly seen in the Ashkenazi Jewish population. In conclusion today, the first thing I want to tell you is not to be scared about talking to someone about an abnormality on your breast. I would probably say that that was one of the biggest things I saw with some of my patients, is them not wanting to tell me or tell someone else that something was wrong with the breast. Please don't be scared. We know that most of these are benign, and it's better off to let someone know right away. The best thing to do is have a good relationship with your medical care professional. Do your self-breast exams on a monthly basis. See your physician or nurse practitioner at least once a year for examination. Early detection of breast cancer, we know, is the best way to cure breast cancer. Fortunately, the breast cancer rates have gone down due to early detection, such as self-breast exams, mammograms, and even MRIs. So continue to do examinations of your breast and see your physician on a yearly basis or sooner if needed.